Well, the first thing to do is to listen to them, of course, and that would mean twofold. One would be to find out what they need and then try and provide it, but also, more importantly maybe, is listen to their actual experience of the services, because you often find that policies and services are well-intentioned, well-designed, but on the ground they aren't actually delivering what you want. So ask the people who are subject to the service what they think of it and what their experience was.
In the past, it's been the tendency for organisations who provide that health and social care to ask older people afterwards, what do you think of the service that we're providing for you? And I suppose that was all very well then, but what older people's groups have been trying to do is to say to those people who provide those services, we don't want you to tell us what you think we need. We want to tell you what we know that we need. And so if that were the way that these providers were to adopt, they would find that they'd be able to give a far better service to older people, and older people would stay healthier and more active because they know themselves what their health and social care should be like. So they would really like a say in designing those services before they are provided. And so they can do that if they, for instance, used organisations like my own. I'm chair of Seniors Together in South Lanarkshire, and what we do is we gather the comments of older people on the health and care, social care issues together, and we do our best then to reflect them so that we reflect them back to the providers of service so that they can then try to work those into the service they provide. And so they could do the work better if they gave older people a say, not just at the level of consulting afterwards, but at helping to plan and design the services that they are there for providing. That would improve things immensely.
Well, I've got more experience of being me than anyone else has. Therefore, my opinion of how I should be treated is better than anyone else's. No decision should be taken about me without involving me. It's as simple as that.
Well, that's really a very big question. I think that as a teacher, and I'm still teaching in the university, older students, self-image is terribly important. And I think older people very often take on board all the stereotypes and all the negativity that's around in society, and they become the victims. And it's not a good thing to feel that you're a victim or feel that life is in decline. So I think one of the most important things to have are actually classes for people to think about themselves and their future life as something very positive, something where they're growing and where they will have new and exciting opportunities ahead of them, not all decline and decay.